So now we come to the third atypical cervical vertebra. This is first one atlas, this is second one axis, and the next atypical cervical vertebra is the seventh cervical vertebra. This is seventh cervical vertebra. You see, these two vertebra looks alike. Both are having more or less similar shape of the vertebral body and also the articular facet, long spine and also triangular vertebral foramen. But one thing is conspicuous in this variety, not here. And in this variety, another feature is conspicuous. What is that? In this vertebra, on the body, there is costal facet. So costal facet means it will articulate with the rib. So it is a thoracic vertebra. And also in the transverse process, there is no foramen, which is a very important feature for the cervical vertebra. In this vertebra, here, there is no costal facet on the body. Instead of that, here you will get this foramen on the transverse process. This foramen is called foramen transversarium, which is present. So though are look same, because of these two important points, costal facet and foramen transversarium, we can differentiate the seventh cervical vertebra from first thoracic vertebra. So this is first thoracic and this is seventh cervical. So now I will discuss the anatomical features of seventh cervical vertebra, also called vertebral prominence. Why it is prominence? Because the spine is unbifid and also it is elongated and tuberculated extremity. Its unbifid elongated spine forms a prominent palpable projection on the surface of the skin. So it is a very useful guide for the surface marking. Then in the body, you will get the uncal process or unset process from each side of the superior surface of the body, and also you will get the anterior surface which is projecting downwards, and this is the inferior surface of the body. This is posterior surface of the body which transmits the basivertebral vein through the basivertebral foramen, and on each side you will get the foramen transversarium in the transverse process. But what is the difference between the transverse process of the seventh cervical vertebra from the other cervical vertebra? The distance between the tip of the transverse process of both sides, here the distance is larger than that of the any other cervical vertebra, and the costal element of the transverse process is small, and the anterior tubercle is often absent, and the foramen transversarium of both sides may not be equal in size and often divided by a bony spiculi, or may be absent on one or both sides. But the question is asked, what are the structures pass through the foramen transversarium? The answer is vertebral veins, not the vertebral artery and sympathetic plexus like that of the foramen transversarium of other vertebra from C1 to C6. So vertebral artery and its plexus, they pass in front of the transverse process, not through the foramen transversarium. Very important point. Which structure is attached to the transverse process? What is the most important structure? The apex of the suprapleural membrane is attached to the anterior border of the transverse process, and the base of the suprapleural membrane is attached to the inner border of the first rib. Then come to the spine. This is the spine, and you know the tip of the spine here, the structure attached is the lowest end of the ligamentum nuchae, and also attachment of the beginning of the supraspinous ligament. What are the cervical nerves? Cervical spinal nerves related to the seventh cervical vertebra. The seventh cervical nerve passes above, and the eighth cervical nerve passes below the pedicle of seventh cervical vertebra. Because you know there are 8 cervical nerve, but there are 7 cervical vertebra, and always the corresponding nerve lying above the corresponding vertebra. So 8 cervical nerve, it is passing below the 7 cervical vertebra or above the first thoracic vertebra. And another important or apt question may be asked, what is cervical rib? Transverse process having two parts or two elements, one is costal element and one is transverse element. Costal element of the transverse process may develop separately and elongated. So this elongated costal element of the transverse process of 7 cervical vertebra is called the cervical rib. And if this is present, it may compress some important structures, and that structures are the subclavian artery and the lower trunk of brachial plexus. So, to relieve the compression of the nerve and artery, surgical intervention is done and the cervical rib is removed. And this triangular vertebral foramen also, it contains the spinal cord and its meninges and the spinal arteries, both anterior and posterior. Then how to hold the bone in anatomical position? You hold the bone in such a way so that the body looks anteriorly, the transverse process or the lateral mass projects laterally, and the elongated unbifid spine, also horizontal spine, it directs backwards. So this is the anatomical position of 7 cervical vertebra.